principles, or sometimes we treat the patient according to prakriti of the patients and the prabhav of the medicines. So we will listen Dr. Ashok what he think about this astrigdar or abnormal uterine bleeding, and then we will take up the views of our experts and question answer from the participants. Dr. Ashok, over to you. If you want to say something about you, you can also share your achievements and your PG.
Yes, ma'am. Thank you, ma'am. Thank you for opportunity. I'm Dr. Ashok Lamani. I have done my PG in SGV Ayurvedic Medical College, Bailongal, Karnataka. In 2019, I have finished. Now, currently, I am pursuing a PhD from Rajiv Gandhi University under the guidance of Dr. Rama Devi ji in SDM, Udupi. So, today's my topic is abnormal uterine bleeding. It's Ayurvedic management. For going for abnormalities, we should know what is normal. So when we say it is normal menstrual bleeding, it should be of 21 to 35 cycle, and the amount should be about 10 to 80 ml of the blood loss per cycle. The duration of the bleeding should be 3 to 7 days. It is also defined as any change in the frequency of menstruation, duration of flow, or amount of blood loss. And there is one more word called DUB, which was used before. So DUB is when there is no palpable pelvic pathology or underlying medical causes have been excluded. And AUB is responsible for 30% of the visits to the gynecological OPDs and amongst women in the reproductive age group, and 69% in the peri and postmenopausal age group. Although women of many age can be affected with abnormal uterine bleeding, it is more commonly experienced by the women of 35 to 45 years of age. It is also commonly seen among the young girls soon after attaining the menarche. That we comes under puberty menorrhagia. Again, AUB is classified into two: chronic AUB and acute AUB. Chronic AUB is like since like AUB in the past 6 months, and it does not usually require immediate intervention. And acute AUB is an episode of heavy menstrual bleeding of sufficient quantity to require immediate intervention to prevent further loss. It can be seen with existing chronic AUB. So these are some terms: menorrhagia, polymenorrhea, oligomenorrhea, metrorrhagia, and menometrorrhagia, which we were using about few years back, but now these words are obsolete. All these comes under only a single heading called AUB. And there was one more commonly used word called heavy menstrual bleeding. It's defined as excessive menstrual blood loss, which interferes the woman's physical, social, emotional, as well as material quality of life. These are some parameters to assess the AUB. Frequency, if it is frequent, less than 24 days. If it is more than 38 days, it is infrequent. And amenorrhea will be considered as absent. The duration, normal should be less than 8 days, and prolonged should be more than 8 days. The regularity, the shortest to longest cycle variation is about 7 to 9 days is regular, and irregular is like shortest to longest cycle variation is more than 8 to 10 days. When it comes to flow, it will be like denoted as light, heavy, or normal. When it comes to intermenstrual bleeding, in a normal cycle, there should be no any intermenstrual bleeding. But in abnormalities, it can be random. It's cyclical. In cyclical, again, we have early cycle, mid cycle, and late cycle intermenstrual bleeding. So, what are the possibilities? As we know, this is like most commonest cause, like uh, hmm, sign or symptom present, complaint present in reproductive age book. We should always rule out the pregnancy and its associated complications. Many times, woman will not be knowing she is pregnant, and she will abort. She will take some abortifacient, and she will come with bleeding. We will be treating this bleeding will be because of some retained or POC. This is a nowadays recent classification by FIGO. That is palm and coin. That is polyp adenomyosis, leiomyoma, malignancy, and hyperplasia. These palm indicates the structural abnormalities, and the coin indicates the uh, non-structural abnormalities. We should always rule out pregnancy. So when it comes to polyp, the most commonest feature of polyp is intermenstrual bleeding, and along with intermenstrual bleeding, there can be chances of HMB and irregular bleeding also. In uterus, in scan, we can see normal uterus. This is a normal uterus. This is a normal myometrium and endometrial junction. Here we can see the endometrial polyp. Endometrial polyp is not clearly visible through normal ultrasound. We can have one feeding vessel sign if you apply Doppler over that polyp. So we need to undergo SIS, that is saline infusion sonography. Same patient, same sonograph, but after saline infusion, we can see clearly there is a demarcation of the endometrial polyp. The gold standard to diagnose the polyp is the hysteroscopy and histopathological evaluation. Next, we have adenomyosis. It is a more common in multiparous women than nulliparous. Uh, Along with HMB, there will be severe congestive dysmenorrhea. This is a typical feature of adenomyosis. There will be no congestive dysmenorrhea in other causes. There will be severe congestive dysmenorrhea in adenomyosis. If any patient complains of HMB along with severe congestive dysmenorrhea, that goes towards adenomyosis. It is the most common in multiparous women, and uterus, like diffuse enlargement of uterus will be there. And when we do PV, uterus feels soft and tender. This is the USG. We can see multiple myometrial cyst here. And there's also a feature called loss of myometrial junction. Okay, so this junction will be lost. In a normal USG, we can clearly identify the junction between endometrium and myometrium, but in adenomyosis, that junction will be lost. There is one more clinical radiological finding called Venetian blind pattern. This is Venetian blinds, which we cover windows, right? So similar to that curtain folds, the USG image will be visible. This is called a Venetian blind pattern. The confirmatory gold standard diagnostic tool is MRI. In MRI, we can see thickened junctional zone. Next, we have leiomyomas. It's a mostly it causes HMB, heavy menstrual bleed. That too, among leiomyoma, only submucosal. That category 0 to 3 category fibroids can cause this AUB. Even it can cause intermenstrual bleeding if the fibroid is 0, category 0. That means intracavity polyp. It mostly causes HMB and irregularly enlarged uterus, in clear like if you and firm to fill, and it will be non-tender. If it is like large, more than 12 weeks, we can uh, palpate these irregularly enlarged uterus per abdominally just above the pubic symphysis. These are the 8 FIGO classifications of leiomyoma. Among all these 8, only 0, 1, 2, and 3 can cause AUB. Other will not cause. This is like USG finding of the fibroid uterus. Here we can see the hypoechoic area along with the hyperechoic. This is a normal. This is endometrium. This is a whole myometrium. It is like in fundus. For intracavity fibroids, the investigation of choice is hysteroscopy, because in the same setting we can do the we can also remove the fibroid. Next, we have malignancy and hyperplasia. Endometrial malignancies like uh, because of unstoppable unopposed estrogen exposure, like in cases of PCOD, there will be no ovulation. The woman will be exposed throughout the period with to estrogen. So this can in later life can cause endometrial hyperplasia, and increasing age, prolonged history of anovulatory cycles, and even tamoxifen use can also cause uh, are risk factors for malignancy. Diagnosis of endometrial hyperplasia is by endometrial sampling and histopathological evaluation. In reports, we get either simple hyperplasia, about 1% of the cases, and complex hyperplasia, about 3% of the cases. Simple hyperplasia with atypia, about 8%, and complex hyperplasia with atypia, about 29%. These percentages of like the conversion of these hyperplasia into the malignancy. If that report comes as complex hyperplasia with atypia, the chances are 29%. Simple hyperplasia with atypia can like the conversion rate is 8%. There was one case I would like to discuss. She was 23 years, unmarried woman, female. She was complaining of bleeding and upper abdominal pain since 2 to 3 weeks. She approached several allopathy hospitals, and same. She was on tablet EVA 35, that is cyproterone and ethinyl estradiol, 1 OD since 2 months. Blood since 2 months, bleeding was not at all stopped. So she came to us. So like present cycle, she was on a 60th day on flow, and 2 to 3 pairs per day. She was having dysmenorrhea, she was having clots, but on USG it was normal. So we did as like everything was normal. We did her PT-INR test. So in that INR was 1.5, and even PT is raised little bit. So these are our reports. Even in scan, it is normal. So we diagnosed this case as AUB due to coagulopathy. So normally, like what is clot forms from an aggregation of platelets, which is then stabilized by the fibrin net. Thus, many coagulation defects leading to HMB can be broadly categorized as either dysfunction of platelet adherence or defect in platelet plug stabilization. First, during initial stages of hemostasis, platelets adhere to vessel wall, breaks through the binding of their receptors to expose collagen. In general, coagulopathies are infrequent causes of gynecological bleeding, and laboratory screening includes CBC with platelets, PT, APTT, and fibrinogen levels. This is the most commonest, will be found in pubertal and adolescent girls. One third of would have been coagulopathy, that is von Willebrand's disease. Even 20% of older age women cases could have coagulopathy, that is idiopathic thrombocytopenic purpura. They will be complaining of HMB since menarche. Even they will be complaining PPH in previous normal deliveries, and there can be chances of history of surgery-related bleeding. There will be history of bleeding from dentum or gum, and there can be chances of epistaxis, failure to respond to conventional treatment. There was one more case of 29 years female. She came to our hospital with complaining of anxious to conceive since 9 years. She took ovulation induction drugs for 6 cycles previously, and she came to us. So we admitted her for Virechana, planned Virechana for her. And from second day of Snehapana, she started bleeding. Her LMP was 2 months ago. So due to which the Snehapana was withheld, and so we planned to control her bleeding first. So So this was a case of anovulatory bleeding, and we have done USG on 13.3, so which shows PC wise. All other reports were within normal limits. This is her report. So we diagnosed this case as A.U.B due to anovulation. So when it comes to ovulatory dysfunction, it mainly causes HMB and irregular cycles, and delayed cycles followed by acute heavy prolonged bleeding is a typical sign of anovulatory cycles. What is means delayed cycles followed by acute heavy prolonged bleeding. This is not a progesterone withdrawal bleeding. This will be the estrogen withdrawal bleeding, or in other words, we call it as breakthrough bleeding. The most commonest cause of A.U.B in adolescent in perimenopausal women is ovulatory dysfunction. These are some causes of anovulation: obesity, androgen excess state, thyroid disorders, hyperprolactinemia, chronic illnesses like liver diseases, and excessive exercises and stress-induced anovulation. So these are investigations to be done. Follicular study, and we all know other tests of ovulation. Endometrial cause. In this, only two will come: endometritis and prostaglandin imbalance. In this case, prostacyclin, which is a local vasodilator, is increased compared to PGF2 alpha. In endometrial cause, prostacyclin, that is PC, is a local vasodilator, but PGF2 alpha is a local vasoconstrictor. PC is elevated, then this ratio is varied. That's why there will be A.U.B. This is mainly the diagnosis of exclusion. We don't have exact test to do this to diagnose this case. We all know there are some iatrogenic causes like use of anticoagulants and all. Even aspirin, heparin, acetrom, all these drugs can cause A.U.B. There are some not otherwise specified. In under this category, we have biometrial hyperplasia and arteriovenous malformations. So this is still under study. So we don't know the exact causes of these things. They say AV malformations are because of the excessive curettage. When it comes to management in contemporary science, they use NSAIDs, tranexamic acid, COCs, progesterones. Progesterones can be oral or LNZ, IUS, or meloxifene, and they use GnRH analogs. And when it comes to surgical management, if there is polyp, polypectomy is indicated. If there is fibroid, myomectomy is indicated if woman is more than 40 years and she has kind of completed her family. If there is fibroid causing AUB, we can advise them hysterectomy. And if there is adenomyosis, the LNJ IVS works wonderfully. And even progestins and adenomyomectomy, they do. And if it is more than 40 years and completed family, we advise them to undergo hysterectomy. Hyperplasia without atypia will be treated with LNG IUS. There was one more case. She was 24 years female. She was she had a history of copper T insertion 3 years back. She came to us with prolonged menstrual bleeding associated with fatigue on exertion. In December, she bled for 9 days. So she consulted nearby hospital and took medication. That what medication she took details is not. But then this got increased in the next cycle, that is in January. Bleeding was there for 15 days. So she came to us. This is her Raja Ruttanta. This is her, she was P2, L2 and A1. Her SB was 8.6 grams. And we did USG. In USG, there was no any abnormalities detected. Only only there was like copper T in situ. So we thought the cause of this A.U.B is due to copper T. So we can take this under iatrogenic cause. So for all these 3 cases, we have treated with this granules. This granule we prepared with Durva Swarasa. What we did, we took Durva, we added Sharkara and we prepared Durva granules. For first patient, which was of coagulopathy, we have given Durva granules 5 grams 3 times a day for 3 days. Within 3 days, her bleeding was stopped. And for all other 2 patients, we have given this Durva granules 12 grams, a single dose, OD. For Snehapana patient, from second day onwards, the bleeding was stopped, but we continued this medicine for 3 days. And once bleeding was stopped, we again continued her Snehapana. Same, we have given 12 grams OD for another copper T patient. So when it comes to Ayurveda, we have Nidanas like Katu, Amla, Lavana, and Vidahi Aharas Ati Sevana. So these are the Nidanas. So when it comes to Samprapti, they say Raktam Pramanam Utkramya, Garbhashaya Gata Siraha, Rajovaha Samashritya, Raktamadaya Tadrajaha, Yasmad Vivardhayatyashu, Rasabhavad Vimanata, Tasmad Asrugdaram, Rahu Re Tatra, Tantra Visharada. So we can have 3 different Sampraptis with this shloka. If woman consumes Ati Amla Lavana Katu and Vidahi Anna Sevana, that will lead to Pitta Dusti. In Pitta Dusti, there will be like Ushna, Sara, Drava and Guna, Ushna, Sara and Drava Guna Ruddhi when it comes to specific gunas. And as we know, Rakta and Pitta is having Ashtra Bhava. The same gunas, Saraguna of the Rakta will be increased. So that this will lead to Rakta Atiruddhi. And one more Samprapti we can have is here the Guru Snigdha Anna, Mamsa, Dadi and Mastu and as well as Divashayana. Because of these Guru Snigdha and Abhishandi Ahara, it will lead to Kapha Dusti. Because of this, there will be Ama and Kleda Ruddhi. Because of this, there will be Rasadhatu Dusti and Dhatwagni Mandya. Because as there is Rasadhatu Dusti and Dhatwagni Mandya, there will be production of Vikruta Rakta. Because of this, again, there will be Rakta Atipravritti. One more Samprapti we can take is Adyashana, Atimaithuna, Yana, Advagamana, Shoka, Atikarshana and Bharavahana. Because of these nidanas, there will be Vata Dusti. Because this Vata will be, there will be avarana of Apana Vata by Pitta. So this will lead to excessive pravartana of Artava. As we know, Artava, like Apana Vata is responsible for Artava pravartana. So because of all these, there will be Rakta Ati Pravrutti. And this Rakta Ati Rakta will be get Sthana Samshaya in Yoni, and this will lead to Asrudhara. These are Samprapti Ghatakas. When it comes to dosha, Tridosha Dusti will be found. And Dusha, Rasarakta and Artava, Agni, Jata Ragni, Srotas, Artavaha, Rasavaha and Raktavaha Srotas. Srota Dusti is Ati Pravrutti. Adhisthana, Garbhashaya and Artavava Srotas, Roga Marga, Abhyantara, and Ama Lakshana is Sama. This is Samanya Lakshana, Tadeva Ati Prasangena, Pravrutam Anvrutavapi, Astrugdaram Vijaniyat, Anyato Rakta Lakshanat. That means woman will have excessive bleeding, prolonged bleeding, Anrutavapi is intermenstrual bleeding, and other Rakta Lakshanas of Sarvadaika Lakshanas will be found. When it comes to Chikitsa Sutra, Yoninam Vatyaladhyanam, Veduktam Miha Bheshajam, Chaturnam Padaranam Chatat, Sarvam Karayat Bhishak, Raktati Sarinam Yachatata, Shonita Pittanam, Raktarshasam Chayat, Proktam Bheshajam Tachakarayat. So we should, like, before directly going for Rakta Stambhana, we should treat the Vata first in this case. And there are like three, they have told for Rakta Stambhana Artha, 4 methods, that is Sandhana, Skandana, and Pachana and Dahana. We should apply Sandhana with the help of Kashaya Rasa and Stambhana Pradhana Dravyas. We should apply Skandana here with the Hima, that means Shita Sparsha Kashayas. And we will apply Pachana with the help of Kshara, that means application of, we can apply Paniya Kshara to the patient for doing Pachana. We have Dahana. Dahana can be done. It is not indicated in Asrudhara, but it is indicated in other bleeding disorders. As we know, before going for Samanya Chikitsa, we should always advise the patient to do Nidana Parivarjana, and better to go Samshodhana, Shamana, Vata, Pitta, Shamaka medicine should be given, and Amapachana, Rudyagrahi, and Shulahara as well as Stambhaka medicine should be given. When it comes to Samanya Chikitsa, even we can do here Adhogata Rakta Pitta Chikitsa, and a young woman using congenial diet, having less complications. It should be treated with Adhogata Rakta Pitta Chikitsa line of treatment. If there is a Raktatisara line of treatment should be given to achieve Rakta Stambhana and Rakta Sangrahana Dravyas, and Raktaja Arsas treatment can be applied here. In Yoni Apat Chikitsa, according to doshas, Asrija, Apraja, and Rakta Yoni and Vatadi Yoni Apat Chikitsa can be applied here. Even Guhya Roga Chikitsa can be applied. Even Garbhasrava and Garbhapata Chikitsa is also told for Asrugdara. As we all know, the Basti is contraindicated during the bleeding phase, but as a acute, as it's emergency Atyayika condition, we can use Matra Basti. Matra Basti can be given with Jivaniya Ghana or Shita Kalyanaka Gruta, or even we can use Matra Basti with Panchatiktaka Gruta. Even Virechana is beneficial in Asrugdara. That's why there is one quote called Garbhashayaha Asruji Virekaha. That means Garbha, like Asrugdara, Virechana is also beneficial in Asrugdara. And Vamana is indicated as it will cause Pratimarga Harana of like it is indicated in Adugata Raktapitta. Even Nasa is beneficial, and that to Shodhana and Shodhana Shamana as well as Brahmana Nasa also can be used in this case of in cases of Asrugdara, as it will stimulate HPO axis and regularizes the HPO axis. It may help the Asrugdara patients. When it comes to Samanya Chikitsa, we can use Dashmula Kshirapakar Kwata and Drakshadi Kashaya can be used. And Nasya and Abhyanga of Shatapushpa Taila, Kshirabala Taila and Durva Swaraza. Nirva Basti with Rasnadi, Chandanadi and Lodradi Bastis. And Mustadi Rajayapana Basti can be used. Anvasana Basti with Mushakadi, Jivaniya Gana Gruta and Shita Kalyanaka Gruta. Uttara Basti, we have done a research, one PG research on this Panchatikka Gruta in our hospital. We found very good results. She already published her thesis. We did Uttara Basti soon after cessation of menstruation for 3 consecutive cycles. Even Uttara Basti can be planned for during bleeding phase, but not intrauterine. We can give intra bladder Uttara Basti. That Mutra Marga Uttara Basti can be advised for during acute bleeding phase. We can use Pichu, Yoni Pichu of Falagruta and PTZ. Even Yoni Praksharana Panchavalkala Kwata can be beneficial. In our hospital, we also do Udara Basti and Udara Pichu with these Shita Kashayas of Pancha Valkala. What we do, we'll soak on gauze or pad in Pancha Valkala Kwata and we'll keep on the Adho Udara. When it comes to Aushadhi Kalpanas in Asrugdara, when it comes to Swarasa, we can use Lajjalu Swarasa as well as Durva Swarasa. Whole Panchanga can be used in the used as Sarasa. Even Vasa Swarasa can be beneficial. When it comes to Kalka, we use Lajjalu Mula Kalka and Appamarga Mula. When it comes to Kwata, we can use Musali Khadiradi Kashaya, Shatavaryadi Kashaya, Maharasnadi Kwata and Darvadi Kwata, as well as we use here Lodradi Kashaya. When it comes to Hima or Fanta, we can use Dhanyaka Hima or Jiraka Hima. When it comes to Asava and Arista, we can use Ashoka Arista. We can use Chandan Asava in case of Pittanubandhi. As we know, anovulatory bleeding, here the Kafanubandha will be there because the menstrual cycle is stuck in that proliferative phase. As we know, the proliferative phase is dominant by Kapha. So there will be Kapha, because of Kapha vitiation, there will be anovulation. Anovulatory cycles will be Kapha dominant cycles. So there will be no Pitta involvement in anovulatory cycles. In such cases, we can use Asava and Aristas in Kapha Jasrudara. And there are some Kshirapakas we can advise to the patient. Ashoka Kshirapaka and Estimadu Kshirapaka basically we practice here. Even Dashamula Kshirapaka also we practice and Panchavalkala Kshirapaka. When it comes to rasa aushadhis, we have a few medicines of rasa preparations like Pradara Ripurasa and Pradaranta Kaloha, but in practice we use here Bolabadha Rasa. When it comes to Gruta and other medications, Shatavari Gruta and Panchatiktaka Gruta will be beneficial. Even Phala Gruta is also beneficial. When it comes to Taila, we have Mahanarana Taila, Shatapushpa Taila and Trifaladi Taila will be beneficial. If it is like Doshanusara, if you want to treat Doshanusara Chikitsa, if it is Vataja Srugdara, we can use Tila Churna with Dhadi or Mastu, Dhadi or Gruta. You can say Dhadi is Abhishandi, but along with Abhishandi, Dhadi is also Vatahara. So we can use Tila Churna with Dhadi and Gruta. Even Varaha Meda Yukta Mamsa Rasa is beneficial along with Kulata in Vataja Asrugdara. In case of Pittaja Asrugdara, we can use Payasya Utpala and Shaluka Kaliyaka and Ambuda with milk, sugar and honey. But in practice, simply we use Estimadu Kshirapaka. And even we use Chandanasava. In Kafaja Asrugdara, as I told, it is mainly annualitary cycle. So we can use here all Asava Aristas along with like these Ashoka Arista and Chandanasava. Even Sarivadhyasava can be beneficial in cases of Kafaja Asrugdara. Even they say Nimba Guduchi Swarasa along with Madhya they should administer.
Excuse me, your slides are not showing the slides.
Yes, ma'am.
Same slide you are talking. If possible,
No,
if you change
Yes,
the slide.
showing, it's
So,
moving.
okay, ma'am. I'm
It's
not
moving.
getting. Okay, ma'am. Mostly I'm
Yeah,
not
it's
getting. I got Patyapata slide only now. Okay, madam. Continue.
yeah, it's moving.
Continue.
Yes, ma'am. If by doing all these treatments, if there is no result found, we can always give a patient with Nitya Virechana by either Ayupatikara Churna or Sukumara Eranda. When it comes to Patya during for Asudara patients, the Patya will be Kshira, Shastikashali, Mudga, Gruta, and Patola. Patola is a vegetable we use here. And Jangala Mamsarasa is indicated, and Madhu, Saindava, Draksha, Amalaki, Dadima, and Lashuna. And the patient should have a normal Samyak Nidra during Ratri. When it comes to Apatya, we all know the Nidanas, all Nidanas are Apatya, including Vegadharana, Vega Udirana, Divasna, Ratri Jagarana, Ati Vyayama, Ati Vavaya, Ati Advagamana, and Ati Yana. Chinta, Bhaya, Krodha, and Shoka. Why Chinta is because we know the Rasadusti Karana is Chintyanam Ati Chintanat. So if there is excessive Chinta, that can lead to Rasadusti. This Rasadusti again can lead to Raktadusti as well as Arthavadusti. And Katu Ruksha, Amla, Guru, Vidahi, Abhishandi, Bhojana should be avoided. And she should avoid Viruddha Ashana and Vishamashana and Anashana. And she should avoid Anupamamsa. But she can take Jangala Mamsa. Thank you, ma'am. That's it from my side. If anything, we can discuss.
Okay, thank you so much. Your presentation was really excellent. You have prepared very good slides and covered all the aspects of modern as well as Ayurveda. And before asking participants, I have some queries regarding this topic, or you can say that's curiosity to know about. That you mentioned about Pani Akshara. Which
Yes,
Pani
ma'am.
Akshara? Yeah, Pani Akshara. Will you explain something about that Pani Akshara?
Panyakshara, we use here for end hyperplasia patients, ma'am. The patient who has endometrial hyperplasia and fibroid, we use, ma'am. We use a tankana. We add a pinch of tankana basma to that kashaya, and we tell them to drink with the dashamula kashaya.
Dashmul Kashaya and Tankan Bhasma.
Ma'am, yes, ma'am.
That you are using.
Yes, ma'am.
Okay. And you told about this uh, Panchatikta Grita
Yeah.
Uttarbasti.
Yes, ma'am. Yes, ma'am.
Yeah, other than that, which any other Grita have you used for Uttarbasti in such cases of Asrikdara?
No, ma'am. Asukdara, as there was that research, that PG research, we did Uttarabasti, ma'am. Otherwise, we won't do Uttarabasti for Asukdara patients, ma'am. Here, more much. We rely on only Basti.
Okay. And in Basti also, you mentioned various Bastis, but I think one Basti that is Kashmiri Kudaja Siddha
Yes, ma'am.
Basti. Yeah. That do you use over there or not?
No, ma'am. That is also our PG research. She prepared a Kashmiri Gurta, ma'am.
Yeah.
That Basti we used.
Yeah. Sometimes people use no.
Clearly, we are
Kash-
not using, ma'am, because Kashmiri and available, it's very rarely available drugs, ma'am.
Okay. And what about this Chandan Bala Lakshadi Tel Matra Basti?
Chandana, that mm, no, ma'am, this is just classical.
No,
Right?
no, not using. And one thing you mentioned about this that Lajjalu Kalka.
Yes, ma'am.
I wanted to know about that some more. That in which form, how, matlab, what quantity you give, at what time, what is the anupan, and during which days, at bleeding phase or after that you are using.
No, ma'am. During acute to stop acute bleeding, we use, ma'am.
Hmm.
In patient got admitted in hospital, so we
Okay.
prepare and we give them 5 grams or 2 times, ma'am.
Lajjalu Mula Kalka,
Yes, ma'am. Lajallu whole plant will take, ma'am.
whole plant
Yes, ma'am.
during bleeding phase,
Yes, ma'am. Acute bleeding to cease
acute
the
bleeding.
bleeding.
And have you seen the result about that?
Yes, ma'am. We found in some patients, but in some patients we have used multiple other drugs also along with the Lajalukalka.
Okay, along with that, you use this Lajjalu Kalka in the patients of Astigmatism. And nice. And any experience about this Nasya?
Nasya, no, ma'am. Well, what we give, no, ma'am. During bleeding phase, we won't give. Once bleeding stops, so we give Pratimarsha Nasya with this Anutaila, ma'am. So we tell them
Anutaila.
to, yes, ma'am. We tell them
Hmm.
to put at their own by them.
Okay. And
This anovulatory bleeding we give, ma'am.
okay, in
Not-
anovulatory bleeding, you give Anutal Nasya. Okay, nice. And I wanted to know some more about that. You quoted about Mansarasa, use of Mansarasa, and you are adding some more things to that. Will you please repeat and uh, what is the reference about that and what is the logic about that? Mansarasa?
Ma'am, Sarasa.
Yeah. You told something that you are adding some dadima like something. Yeah. You mentioned to add some more things in that Mansarasa.
Ma'am, Sarasa, ma'am.
Yeah.
Ma'am, Tilachurna and Dadi and Gurtana, ma'am. That one.
In Mansarasa.
That Varaha Medayukta Mamsarasa, ma'am.
Then, okay,
Kulata, with Kulata, I told, no, that one.
okay, okay.
So
You are
that
adding that,
Kulata may, idu ma'am,
but I heard
to
like Tadima and something you told my about Mansarasa. Okay, no
I
problem.
told
This
Varaha
was
Medayukta
this were
Mamsarasa and
some
Kulata.
queries from my side. I wanted to know something.
Okay, ma'am.
I just listened and had some queries regarding your presentation.
Thank you,
So
ma'am.
now I will have some expert opinion or questions from our participants also.
Okay, ma'am.
Yeah. Ramadei, madam, do you want to add something in this presentation from your side, expert opinion?
Namaste, ma'am.
Namaste, madam.
Congratulations, Ashok. Good presentation.
Thank you, ma'am.
Okay.
Presentation was really excellent. Excellent.
Excellent presentation. But
Yeah.
all sides I didn't get, madam. Somewhere it was stuck for me. But anyhow, I heard everything from the beginning. Nice presentation. But that some of the drugs, like you might have added, but still it's okay. Kashmir Kuttaja Siddha Gruta or only Kashmir Gruta na? Ashok.
Kashmir Adi Gurta, ma'am.
Kashmir
In that,
Yadi so Kuttaja is there. Classical preparation.
hi, ma'am.
Yeah. Madam, that we are here also we are giving Kashmir Kottacha Siddha Gruta Uttaravasti. And no, I have one doubt. Because I didn't done that one. But whether can we give this in orally?
This Gurta, ma'am.
I have doubt, madam, whether we can give orally also, no? Because everyone is, classical reference is there. Everyone is doing Uttaravasti only with this.
Yeah, madam. This can be given orally.
Orally also.
Yes, and it is effective. That Kotaj in any form during bleeding phase is helpful. Yeah,
Helpful.
if I have sometimes used Kotaj Ghanvati also if I'm not having anything
Yes,
and
madam.
patient is having bleeding, so I add sometimes Kotaj Ghanvati also for that
Yes,
patient
madam.
and
That
get result.
reduced.
Yeah, yeah. Kotaj
Yeah.
is helpful. So Kashmiri Kotaj say the great if you have and you feel that it will help, you can give oral also.
Okay.
Yeah,
This time we
yes,
are
madam.
trying. May
Yeah,
publish the thesis in near future. We are planned.
yeah.
Otherwise,
And one thing he mentioned, madam, Sandhan Skandan Pachan Dahan, right? That
like bleeding.
principle, yeah, that principle is very good. Sandhan Skandan Pachan Dahan is good, right?
Yes, that also good. Dahana, but no, we can't do here. No, Ashok, we can
No,
where we
ma'am.
can do dahana.
Dahana in Asubdra is not,
Not possible. If
in
there is
certain
any
modern
like a
areas,
polyp,
ma'am, nowadays they do this ablation.
no,
That
like
can be
if there is
considered.
any polyp is there, no polyp, and if you
Yeah,
do
ma'am.
the excision in that case, you may do dahana, but that is no submucous polyp is there, means that leads to bleeding like that. But still, that is also difficult.
Yeah, ma'am. Nowadays they do, no, ma'am, endometrial ablation and laser therapy. That can be considered under Dahana, I think.
Taken as dahana, na?
Yes, ma'am.
Okay, good.
Madam, you have to add something. Your
No,
opinion, your opinion, your experiences about this. Yeah.
Madam, here no, we are with that. No, we are. I am giving village, na. But now I started with Vasti, madam. Some patients know we village something. That means I start. I mean, not during bleeding phase. After bleeding is stopped. Yoga Vasti I started. That also gave good result, madam. Yoga Vasti I started, madam. Yoga Vasti I started, madam. Like course. So that gave good result, madam, to the patient. Dashamula Kshira Paka. The Dashamula Kshira. With that, I'm giving the Astapanavasti and then this any Vatahara Taila. Once I gave with Varnadi Gruta, Anuvasanavasti I gave it. That gave good result actually. In case
Okay.
of thick endometrium.
Okay.
all Shamana Chikitsa, whatever is there, everything I gave. Chandrakalaras, Gokshiradi Gugulu, Pusha, Nega, Shokaris, Lodras, everything. But still patient repeating then. So I plan to give that Yoga Vasti. One course Virachana given, madam. One course Yoga Vasti given, madam. And that also gave good result. Plan for Uttara Vasti, but that gave good result waiting. If next episode, if it's heavy bleeding, I will give Uttarasti to that patient, madam, next episode if it is there. But otherwise also Yogavasti, I tried for 2 patients, it gave good result, madam.
Yeah, very nice. Very nice.
Uh,
Nice.
it gave good result.
Madam, you can try this in the bleeding due to uterine fibroid also. If you are doing with
But
Varunadi
Lekanavasti we can give, madam. Yeah, for Rastapana,
No, madam.
Lekanavasti we can give. But
Uh,
no, before, years before I done, madam, but somehow I didn't get result with that. Fibroid,
see,
size is
see,
not reduced, madam, in that case, but some symptoms and all pain that and all reduced during bleeding phase, pain is reduced. But I'm not satisfied with that, so not tried again.
see, madam, your combination says that when there is uterine fibroid and
Mm,
due to fibroid,
mm.
sometimes we are having patients are having scanty menstruation, sometimes amenorrhea, sometimes heavy
Okay,
bleeding, right?
okay.
In those cases, when you are doing this anuvasan with Varunadi
Mm,
that may help in the cases of uterine fibroid also.
okay. Mm,
Yeah, when patient is having bleeding due to uterine fibroid, then you can give this combination. Combination is very nice. Then you are
mm, mm,
discussing this Nadigrita
mm.
and Astapan with Dashmal Kshira. But that,
Dashamalakshira.
yeah,
Brahmanana,
yeah,
madam, Vatahara. So I
yeah.
gave. One of my colleague, madam, she worked on fibroid for 2 batch students. She gave one fibroid, and she gave Pichavasti and this Yoga Vasti and all for one group. That also gave good result. Size is reduced a bit, little, 1 centimeter or half centimeter, like that. It is reduced, but got good result. Means one course gave one good result. If it is every 6 months, if we done, no, it might have still reduced the size, it seems. That we got result. Pichavasti given one group and Yoga Vasti given another group.
Yeah, Pichavasti is also helpful. Yeah, that was my
In
also.
fibroid and bleeding, madam, that case.
Yeah, that was also
Mm,
my query. I forgot to
mm,
ask to Dr.
mm,
Ashok.
mm, mm.
Have you used Pichabasti in the cases of Asrikdar also? Then Shalmali
Mm.
Siddhagrita also is helpful in such cases
Yes,
also.
yes, yes,
That
yes, madam.
I
Yes.
remember that if you can prepare, that will also help in such
Mm.
cases. And
Yeah, madam.
Pichabasti is, yeah, Pichabasti is also very,
That is in it is there, no, madam, in Pichavasti indicate advised, Asrugdara, no, like Raktatis or somewhere it is advised, no, madam. Asrugdara also we can give the same treatment that before we are given, madam. Some other teacher worked on that. That also gave good result. Asrugdara and Asrugdara Pichavasti given.
yes, same thing. That
Pichavasti. For
Pichabasti,
thesis we
yeah.
gave, madam, that gave good result. Afterwards we tried another result, so that was not regular practice here. Some doctors are giving, but it is not in my practice actually.
Yeah, that is not very much easy to prepare and
Um,
some tedious job to give
mm,
Pichabasti, so people are not using. But
mm.
Pichabasti is very much helpful
Kindly
in
stop
such
share,
cases.
Dr. Ashok.
Yeah,
Sir, namaste.
Stop share. Your screen is shared, so speakers are not visible. That's why I'm. Kamini ji, kindly continue. Sorry for
yeah,
it.
yeah. Yes. Ashok, stop sharing screen share if you have to stop, so we can listen. Yes, nice, good. So we have some other experts also. We can ask them also to add if they want to add. Then, or we can have a question. Dr. Diksha, if you want to add something in this, your experiences, if you want to share, Dr. Diksha, if you can. Dr. Krupa.
Hello, good evening, ma'am.
Good evening.
गुड इवनिंग मैडम. कॉन्ग्रेचुलेशन टू डॉक्टर अशोक. मैंने आधे से ज्वाइन किया है, मैं क्योंकि बाहर थी. जस्ट घर पे आई और मैडम का मैसेज आया, मैंने फटाफट ज्वाइन कर लिया. ये मेरा फेवरेट टॉपिक है, डीयूबी वाला. सर जब कामिनी मैडम हमारे कॉलेज में थी, मेरे टीचर थे, तब भी हमने ये एक प्रेजेंटेशन रखा था. तो तब भी जो बात हुई थी और जो फंडा क्लियर था, मैं अभी भी अप्लाई कर रही हूँ. लेकिन आज मुझे बहुत नई चीजें जानने को मिली जो हम मेरे कॉलेज में प्रैक्टिस नहीं करते. फर्स्ट ऑफ ऑल इज द पंचकर्मा बस्ती. हमारे यहाँ मेनोरेजिया या एबनॉर्मल यूट्राइन ब्लीडिंग के जितने भी पेशेंट आते हैं, मोस्टली दे आर हैविंग एडिनोमायोसिस और एंडोमेट्रियल हाइपरप्लेसिया. तो we have never given basti or yog basti, uttar basti to them. We are given only oral medicine, and then also we are getting good result. But now I am thinking कि मुझे ये भी करके देखना चाहिए, particularly उत्तर बस्ती. वो हमने कभी नहीं दी है. सिर्फ ओरल मेडिसिन से ही 2 से 3 महीने में उनको ब्लीडिंग काफी कम हो जाता है, और दे आर स्टिक टू ओरल मेडिसिन ओनली, कि अगर इसी से काम होता है तो पंचकर्मा नहीं करवाना है. पर एक है कि
कौन सी मेडिसिन करते हो?
मेनली, हाँ यस यस मैडम, मेनली मैं 3 चीजों पे ध्यान रखती हूँ. एक है रक्त स्तंभन देना ही देना है. तो रक्त स्तंभन में पुष्यानुग, अशोक, लोध्र, वासा, अर्जुन, हरितकी, ये पेशेंट में कौन सा दोष ज्यादा है उस पे डिपेंड करके, जैसे वात है तो हरितकी ऐड करती हूँ. अगर पित्त है तो लोध्र और मुक्ता शुक्ति भस्म, और वासा उसमें भी ऐड करती हूँ. और कफ है तो वचा और यष्टि मधु ये ऐड करती हूँ. और पुष्यानुग सब में, पुष्यानुग और नाग केसर कॉमन है, ये चीज है. और फिर एक है हमारे यहाँ रक्त संबंध वटी करके एक हमारी कॉलेज में बनाई हुई है, उसमें भी मोस्टली यही ड्रग है. नाग केसर पुष्यानुग ही है, और उसमें जम्बू है और शालमली है, मोच रस है. तो ये दोनों चीज मैं रक्त संबंध में देती हूँ. दूसरी चीज मैं देती हूँ एक वातानुलोमन के लिए, और तीसरी है पित्त शामक के लिए, जो मैंने कामिनी मैडम से ही सीखा है कि सुबह में घृत पान देना है और शाम को उसको विरेचन करवाना है. तो सुबह में एम्प्टी स्टमक में उनको तिक्त, महातिक्त घृत या पंचतिक्त घृत या कुछ भी, अगर वो भी नहीं ले पाते तो दाढ़ीमादी घृत या फिर गोघृत, वो 20 ml एम्प्टी स्टमक उसको एडवाइस करती हूँ. और अगर पी सकते हैं तो 30 ml तक, उससे ज्यादा नहीं, 20 to 30 ml मैक्सिमम. और शाम को अविपत्तिकर चूर्ण देना है 5 से 6 ग्राम हैवी डोज में, और इस तरह से नित्य विरेचन करवाती हूँ. तो ये 3 मेरे रहते हैं कि ये 3 चीजें मुझे ओरली देनी ही है. और फिर अगर कुछ फाइब्रोड है या कुछ पोलिप है, फाइब्रोड मेनली, पोलिप है तो पोलिपेक्टोमी के लिए बोलते हैं, लेकिन अगर फाइब्रोड है और उनको ऑपरेशन नहीं करवाना है तो फिर उसमें कांचनार गूगल या ऐसा कुछ ऐड करते हैं. लेकिन ये 3 से उनको काफी अच्छा रिजल्ट मिलता है. और एक चीज मैं खास ये देखती हूँ, अगर वो घी नहीं पी सकते तो मैंने ये देखा है कि ये स्तंभन औषधि देने की वजह से कॉन्स्टिपेशन रहता है. मे बी इनका जो स्तंभन गुण है उसकी वजह से हो सकता है. तो फिर उसके लिए मैं ऐसे ही अभिपतिकर चूर्ण तो देती हूँ कि पित्त शमन भी होगा, वातानुलोमन भी होगा. अगर घी घृतपान नहीं कर सकते तो भी चलेगा. लेकिन ये 3 चीजें से ये मुझे बहुत अच्छे रिजल्ट मिले, सिर्फ ओरल ट्रीटमेंट से. नो बस्ती, नो उत्तर बस्ती, नो नशिया, नॉट इवन विरेचन क्लासिकल, पर ये एक नित्य विरेचन से बहुत ही अच्छा रिजल्ट मिला है. तो आई एम रियली वेरी थैंकफुल टू कामिनी मैडम कि ये एक फंडा क्लियर हुआ कि इनको नित्य विरेचन देना है.
ये मेरा अपना स्टाइल याद रखा है, वो आई एम
हाँ, और मैडम अप्लाइंग
वेरी ग्लैड कि जो मेरा स्टाइल है विरेचन देने का वो याद रखा है और अप्लाई भी कर रहे हो आप. इट्स रियली
यस
नाइस.
यस
हाँ,
यस
और दूसरा मैं ये बताना चाहूंगी, कृपया इसमें आप अनुपान दे सकते हो. जैसे मैं करती हूँ, जैसे पुष्यानुक तुम दे रहे हो, लेकिन
हाँ.
अनुपान क्या देना है तो उसमें
मैं
अनुपान.
अनुपान में मैडम जनरली मैं इनको ये तंदुलोदक और हनी का बोलते हो, लेकिन वो तंदुलोदक बनाते नहीं है हर रोज. तो फिर मैं सिंपली बोल देती हूँ कि आप पानी में हनी 1 चम्मच या 2 चम्मच डाल के घोल दो और उसी में ये पाउडर डाल के उससे पी लीजिए. और अगर जो पी सकता है तो उनको दूर्वा स्वरस या वासा स्वरस से पिलाती हूँ। लेकिन
यस
वो
यस।
इतना इतना कड़वा होता है कि नहीं, वासा तो बिल्कुल नहीं पी सकते, लेकिन दूर्वा से मैडम पी लेते हैं। और जो
यस
एडोलसेंट गर्ल है उनको फिर मैं शर्करा और सौंफ का पानी बोलती हूँ कि आप उसका शरबत बनाइए, उसमें ये पाउडर डालिए और पी जाइए।
यस यस, नाइस।
हाँ
ये अनुपान
हाँ
अगर हम यूज करते हैं तो ज्यादा इफेक्ट हमें मिलता है। पेशेंट्स हमारे दुर्वासोरस यहाँ तो बहुत अच्छे से बना लेते हैं, मतलब जो 40+ फीमेल्स हैं उनको अगर आप बोलते हो हैवी ब्लीडिंग है ड्यू टू अननोन कॉज,
ये
पेरीमेनोपॉजल है, हैवी ब्लीडिंग हो रही है, कोई आपको पॉजिटिव फैक्टर नहीं मिल रहा है, पुष्याणु दे रहे हो, सिर्फ दुर्वासोरस अनुपान उनको बोल दो कि हाँ ठीक है आप दुर्वासोरस अनुपान इसमें घोल के पी लो, पेशेंट खुश होके पीती हैं, बनाती हैं, और इम्प्रूवमेंट भी मिलता है इसमें। तो अनुपान का भी बहुत ज्यादा इसमें रोल रहता है। कोई भी मेडिसिन अगर हम ओरल देते हैं तो अनुपान अगर सही रहता है, तो अब जैसे आपने उसको क्लासिफाई कर दिया कि एडोलसेंट गर्ल है तो हम सौंफ का पानी देंगे, तो हाँ ठीक ऐसे ही हम थोड़ा क्लासिफाई करके अनुपान करके देते हैं तो हमें रिजल्ट मिलता है ना।
यस
काफी
यस यस
काफी इम्प्रूवमेंट मिलती है पेशेंट्स में, अच्छे रिजल्ट मिल जाते हैं इन केसेस में।
हाँ।
हम्म।
लेकिन ये एक है कि मैं उत्तर बस्ती कभी ट्राई नहीं किया, लेकिन एक दो पेशेंट है जो जिनको ये याप्य कंडीशन जैसा हो गया, पर्टिकुलरली एडिनोमायोसिस में, कि जब तक मेडिसिन लेते हैं तो अच्छा है, बाकी जैसे ही बंद करते हैं वापस से ब्लीडिंग स्टार्ट होता था। तो मैं आज ये सीखा कि मैं उनको पंचतिक्त घृत की बस्ती, उत्तर बस्ती पर्टिकुलरली, वो देख के मैं ट्राई करूंगी कि कैसा रिजल्ट है इसमें।
हाँ, उनमें मात्रा बस्ती भी ऐड कर सकते हो आप ना, उत्तर बस्ती दे दी, उत्तर बस्ती
हाँ
आपने 5-6 दिन दोगे, उसके बाद मात्रा बस्ती कंटिन्यू कर दो 8-10 डेज, है ना।
ओके पक्का,
दैट
यस
विल बी
यस मैडम।
बेनिफिशियल। यस यस।
यस
और उससे
और
काफी इम्प्रूव मिलता है। हम्म।
यस, और एक चीज ऐड भी वो भी ऐड करूंगी कि जिनको पेन रहता है तो हम वो कृष्ण मृत्तिका लेप भी करवाते हैं। वो जामनगर से ही, वो भी हमने वहीं से सीखा है कि ड्यूरिंग
हम्म।
मेंस्ट्रुएशन हैवी ब्लीडिंग के साथ अगर पेन है ज्यादा, तो कृष्ण मृत्तिका जो यहाँ पे ही मिलती है, यहाँ पे सौराष्ट्र में पर्टिकुलरली काली मिट्टी, तो उसका आटा बना के पानी डाल के, नॉर्मल पानी डाल के या ठंडा पानी डाल के आटा गूंद के, थोड़ा सा वो एकदम से हार्ड नहीं करना है, थोड़ा सॉफ्ट डो बना के उसको लोअर एब्डोमेन पे लगा देना है। उस तरह से वो शीत लेप करना है, शीत शेक करना है, तो उससे भी पेन भी कम हो जाता है और एक झटके से मेंसेस निकल जाता है।
हाँ
तो
बिल्कुल, वो
यस
भी बहुत
तो
अच्छा इसमें हम जामनगर में जो यूज करते हैं, इट्स रियली हेल्पफुल। इसमें
यस
डॉक्टर अशोक आपने भी कुछ बोला था ना, मृतिका लेपन जो आप करते हो थोड़ा अलग स्टाइल में, थोड़ा वो उसको बताओ जरा।
We use udara pitch, ma'am.
व्हाट इज योर स्टाइल यू यूज? हाँ।
पंचवल्कला पंचवल्कला कषाय है ना मैम, उसको पैड में पूरा सोक करके वी विल कीप ओवर लोअर एब्डोमेन।
लोअर एब्डोमेन, ओके। फॉर हाउ many time? 30 minutes, 15 minutes, 40 minutes?
यस मैम, 1 आवर तक रखते हैं मैम, उसके
वन
बाद हटा
आवर
देंगे। जब
वन
सूखता है तो अगेन विल पोर सम कषाय ओवर दैट।
ओके ओके, देन you can add this mritika to that panchvalkal kashaya also, that will be more beneficial, I think so.
मृतिका मैम।
Yeah, mritika
ओके।
in this kashaya that you are using, panchvalkal kashaya, in that
यस मैम।
kashaya also use कृपा। इसमें थोड़ा सा ये भी है कि जैसे आजकल मृतिका चिकित्सा जो हो रही है वो इस रही है, जो ग्रोथ डिसऑर्डर्स है ना, यूट्राइन फाइब्रोइड, एडिनोमायोसिस, इनमें जो भी आपके पास शोथकर द्रव्य हैं
यस
वो
मैम।
मिला के उनको मिला के फिर इस मृतिका का लेपन करते हैं, तो वो भी उसमें
ओके,
स्पेशल, यस,
तो
नॉट।
हम मैडम दशमूल क्वाथ में मिट्टी भिगो के कर सकते हैं।
हाँ हाँ, जो भी आपके
ओके।
पास शोथर शोथर द्रव्य है, जैसे मुस्ता है ना,
हाँ हाँ।
उसको भी उस चूर्ण को मिला के रात में भिगो दो उस मिट्टी को, फिर वो उसमें सुबह उसको लेपन कराते हैं। आजकल मृतिका चिकित्सा में ये यूज हो रहा है कि शोथर द्रव्य आपके पास जो भी अवेलेबल है, नहीं तो
मैम
शोथर कषाय भी मिलता है मार्केट में शायद, है ना, तो वो शोथर
ओके
कषाय, हाँ शोथर कषाय में इसको रात में भिगो दो मिट्टी को, फूल जाती है, फिर उसको सुबह उसको लगाते हैं, तो वो भी इसमें फाइब्रोइड में, एडिनोमायोसिस में, इनमें सब में हेल्पफुल हो रही है, मतलब जो आजकल यूज कर रहे हैं।
मैम,
ओके
मिट्टी कौन
ओके।
सी, नॉर्मल मिट्टी?
नहीं, मृतिका चिकित्सा के लिए मृतिका मिलती है। अब तो पेशेंट अमेजोन वगैरह से ऑर्डर ऑनलाइन मंगा लेते हैं, तो वो मृतिका मिल तो इस पे लगाने के लिए जो आती है, मृतिका चिकित्सा के लिए आती है, तो अवेलेबल है आजकल, ऑनलाइन मिल जाती है। पेशेंट हमारे तो जैसे मैं बोलती हूँ तो ऑनलाइन ऑर्डर कर देते हैं और वो मंगा लेते हैं।
ओके
फिर उनको एक्सप्लेन करते हैं कि इसको आप ये वाली मेडिसिन जो उसमें मिला के, पहले तो उनको एक आधी बार तो बता देते हैं, और जो मृतिका चिकित्सा में करते हैं वो क्या करते हैं कि कपड़े के ऊपर लगाते, फिर उसको कपड़े को उल्टा करके फिर एब्डोमेन पे लगा देते हैं, है ना। हाँ तो
एज अ
फिर
पैक।
हाँ तो वो कवर हो जाता है मृतिका, तो फिर वो ज्यादा उसमें इफेक्टिव रहता है। वो आजकल ऐसे यूज कर रहे हैं, वो मृतिका चिकित्सा जो करते हैं उसमें। तो अब वो भी हम ऐड ऑन करते हैं पेशेंट्स
ओके
में कि
Yes, yes.
Excuse me, ma'am. Sir, actually, your presentation was very good, sir. Very detailed and very clear. And sir, I have a doubt. If for this 13, 15 years, in between 13 to 15 years, teenagers with around 1 or 2 years of since menarche, they are having continuous bleeding, prolonged bleeding, like as you said in PCOS when you explained, they have prolonged bleeding with delayed menstruation. So these are, I find it very difficult to treat these cases, sir. And I have a doubt, they take at least 2 to 3 weeks to stop the bleeding. With I usually give Chandraprabha, Chandrakala, Ushirasav, Pushanuk Churan, but it takes a long time. Sometimes Ushirasav I replace with Lodrasav also, but it takes very long time. And my another doubt is, how do we change the, once the bleeding stop, then what is the next set of medicine we should give? Because usually these patients are obese. These
ma'am.
patients are very obese and the typical PCOS symptoms. They're getting bleeding once in 2.5, 3 months. And the bleeding prolongs up to 3 weeks, sometimes spotting, and all of a sudden bleeding, 1 pads, 2 pads per day, sometimes 1 pads per day. Again, 2 days of spotting, again heavy bleeding. Can you please explain this kind of cases in detail, sir?
In these cases, no, ma'am. First, we'll give something to stop. Sorasa, you can use, no, ma'am. This Gairika,
Durva.
and I think Durva Sorasa or this Lajjalu or Vasa Sorasa also can be beneficial, ma'am. In these cases, once
Okay.
bleeding stops, we should concentrate on their hormonal correction करने के लिए. Like we can give them this Kumarasava, or we can use this Saptasaram Kashayam or Sukamaram Kashayam. As a every day they can take, ma'am. Once bleeding stops.
Only single Sukumara Kasha or along with other drugs?
Sukumara Kashaya and Kumarasava you can give. Or else you can give along with Falagruta also you can give, ma'am.
Okay, Falagrata also. Sir, Kumari Asava will not increase the bleeding?
No, ma'am. It will regularize her. It will correct her hepatic
Okay,
secretion.
yeah,
So
Kumari
it will correct
Axon.
her SHBG. SHBG ठीक हुआ तो it will again correct her HPO axis also.
Okay.
And we can give Pratimarshanasya every day.
Anutaila.
इसमें अनुतैला और शतपुष्पतैला. Here we use basic में most commonly अनुतैला, मैम. बिकॉज शतपुष्पतैला कभी कभी मिलता है, कभी कभी नहीं मिलता है, इसलिए
If we have to prepare Shatapushpa Taila, in the Kalka Dravya, we have to put only Shatapushpa, or we have to add any other Dravya also along with Shatapushpa?
I should see that formulation.
Okay. No, which is a reference, sir? You have any idea of the reference of this Shatapushpa Taila?
शतपुष्प शतावरी अध्याय कश्यप में है, मैम.
Kashyap. Okay.
शतपुष्प शतावरी अध्याय.
Okay, sir. Thank you. And sir, I wanted little more this of fibroids. Do you have any experience like where the fibroid has gone totally up to 3-4 centimeter size? And what medicine?
We use here Lekana Basti, ma'am. For such patients, if there is no acute bleeding, we use Lekhana Basti by adding Gomutra.
Okay. Okay. And
Erandamula,
Kvata Dravya and Kalka Dravya for that?
Kvata Dravya, either it sometimes Erandamula di or sometimes we use Dashamula Kvata, ma'am.
Okay. And Kalka
And
Dravya?
Nityananda Rasa tablet, we'll crush and we'll add the tablet as a Kalka.
Only
And
that
as a,
much. Only Nityananda
ma'am, Nityananda.
and no other Kalka Dravyas.
No, ma'am.
And Nityananda, how many tablets? Usually we add around
Four.
40 grams of Kalka in these bastis.
Four tablets, ma'am. As it is very concentrated, no, ma'am. We use only 4 tablets here.
Okay, 4 tablets of Nityananda, Erandamula Kvata, and Tela is Murchita Tila
Gomutra.
Taila. And
No, ma'am.
Gomutra.
Taila we use Pippaladi Taila.
Plain Pippaladi Taila. Okay.
Pippaladi.
Okay. And we have got the good results. Totally fibroid has gone, sir?
No, ma'am. Fibroid will not completely go, but it will, suppress its somewhat size, and it will not, allow
Grow
it to
further.
grow further.
Okay. And no, and sir, according to the in case of infertility, if it is like intramural fibroid,
Yes, ma'am.
do we need to worry about that depending on the site or something like that, or we can just let go of that?
It depends on size,
Factor.
ma'am. If it is indenting that endometrium, then we have to worry. If it is not indenting, if it is not touching endometrium, so no need to worry, ma'am.
No,
Until
maybe initially for implantation, if it's not it may not disturb, but later on, because if it grows like during pregnancy,
during
that time
during
can.
pregnancy, it won't grow, ma'am, as it is estrogen dependent, right?
Okay.
During pregnancy, it is high progesterone, so it will not grow during pregnancy. जितना size रहेगा during like before pregnancy, almost उतना ही रहेगा. एक
Okay.
बार implantation हो गया तो we will not worry much. Implantation हो गया और first time से cross हो गया तो if it is like
Okay.
disturbing that endometrium, then we should do.
And if they are carrying, if they are going through their pregnancy along with fibroid, we can matlab, encourage them to have normal delivery only. There is no need of asking them to go for.
It's not like absolute indication. It's possible, ma'am, but we should be ready for that post-partum hemorrhage.
Okay. So that could be a complication post-mortem hemorrhage.
Because of fibroid, because that fibroid का portion जितना रहेगा वहाँ पे contraction नहीं हुआ तो अच्छे से, so it may lead. होगा ही नहीं ऐसा नहीं है, but we should be ready.
Okay. Okay, sir. And what about polyps, sir? Can we totally, matlab, is there any experience where you have totally the polyp is gone with our medicines?
No, ma'am. Actually, polyp rata we do polypectomy only. Because it's like Ayurveda only they have told this is Shastra Sadhana. So we can't wait much.
Okay. Okay,
Bleeding
sir.
we can stop with these medicines, but polyp को पूरा with बड़े सिर्फ medicine से cure करना is difficult.
Okay, sir. Okay, sir. Thank you so much, sir.
Okay, Deepika.
Yeah.
I was listening conversation, but I cannot stop myself, so I will add something in this thing.
Yes, ma'am. I would always be happy to listen.
You were asking about adults and girls. So in
Yes,
those
ma'am.
cases, as Dr. Ashok also mentioned in his presentation, that in this cases, patients are having anovulatory cycles, and due to anovulatory cycles, patients are having a bleeding, right? So
Yes, ma'am.
we have to give some, we can say that Medhya Rasayan also in this cases. like you can use just like if you are giving nasya, so better to give Brahmigrit nasya instead of Anutel, right?
Okay. Yes, ma'am.
Sometimes you can add Tagar also, Shankpushpi also. That should be added in all these medications, whatever you were discussing. And he mentioned, if you give this, then she may have improvement in this cases. She will have ovulation properly, and then matlab, it enhances regulation of ovulatory cycles. So that should be added in this cases. Some
Yes, ma'am.
Yes.
media, yeah, some media drugs should be added, right? And second thing, in fibroid with pregnancy, that I have seen my patients who were having fibroids and conceived after treatment, 4-5 centimeters are not creating any issue. Patient had full-term normal pregnancy, normal delivery, no postpartum complication, anything she had, and they are delivering normal, no problem. 4 centimeter up to 4-5 centimeter, there is no issue with the pregnancy. And fibroid is not the indication of cesarean section. So if patient is having fibroid with pregnancy, they will not do cesarean section if any other indication is not there. So patient can have normal delivery, no problem.
Yes, ma'am. Ma'am, even in case of submucosal also, there won't be any problem.
No problem. I have seen no problem in my patients. The patient
Okay.
conceived, and then yeah, fibroids are not creating any issue with pregnancy. I have not seen in my patients. Although it is mentioned in books that they may create any issue with the, but in my cases, I have seen whatever the cases, um, my case is conceived after treatment, and they didn't have any issue with their pregnancies. I have not seen.
Ma'am, will they
Well,
have
it
any
is
complication?
it
Will
is
they
not
have any
absolute
complication?
indication of cesarean section, so patient may have normal delivery and no other
Yeah.
complication arised. No complication arised. Yeah,
No,
yeah.
ma'am. Usually, because I don't conduct deliveries and all, I just see the ANCs up till 9 months. So I need to give them proper advice. Usually, what they have been advised is you have a fibroid, you go for cesarean section, so that will remove the baby as well as the fibroid.
But though
So
they don't remove fibroid at the time of cesarean section. Yeah.
okay.
Though they don't remove last week also I had one patient. She had history of fibroid and history of cesarean section. She was not my patient. She came that I had cesarean section and this fibroid is having prior to pregnancy, and this is the my report, and she came to me for the treatment of fibroid only. She was not came for she didn't came for treatment of infertility, but she had fibroid prior to pregnancy, had cesarean section. They didn't remove, and that persists. And now, after 1 or 2 years, that grows, and she came for treatment. So they
No,
don't
they didn't
remove.
remove. Yeah, they are not supposed to remove, ma'am. Is it a
Yeah, they are.
contraindication to remove,
Yeah,
not to remove during LSCS?
and during LSCS, they don't remove generally fibroids. They don't
Okay.
remove, because at the
Excuse me,
time
ma'am.
they just remove the baby and just close the uterus.
Uterus. Excuse me, ma'am.
Yeah,
That time there will be heavy bleeding, no, because uterus is hypertrophy, no. There will be
yeah.
heavy bleeding, madam. That's why they won't touch the fibroid.
They don't touch
Mm.
fibroid. They
Mm.
don't remove
Right.
fibroid at the time of cesarean section.
Mm.
Yeah.
We have few
So
patients here, ma'am.
yeah.
Madam, shall I add one point? Madam, shall I add one point?
Yeah, yeah, sure, madam, sure.
Fibroid patients, madam, and actually, in textbook it is given that premature contraction, that there are cases, madam, that we can manage with Ayurvedic drugs only. Before long back, I tried a few patients. There will not be any premature contractions with giving Balamula Kshirapaka orally.
Yes,
Hello.
yes, nice,
Uh,
nice, madam. Yes.
like that. And no, that madam is asking another madam, need not to means that the patients, some patients deliver normally only, madam, because there is not cervical fibroid, it is at the fundus, and there is no complications, madam. That is why they are not there. They undergone, few are undergone cesarean section, few undergone delivered normally vaginal route. There will not be any complications, but there are few patients, madam, Small fibroid also given much complications throughout the pregnancy.
It depends upon site, madam.
Site.
Depends upon,
Yeah.
yeah.
But we actually 8 to 9 centimeters fibroid is there. That is managed without any complications. 4 to 5 centimeters fibroid is complicated.
Time, madam,
Like
time.
fibroid.
Yes, ma'am. Thank you so much, ma'am.
Yeah. So I think we have covered our time. So I would like to thank Dr.